It's very common that people will come in and talk to me and say, well, somebody told me 15 years ago, that I need a knee replacement and I've just been toughing it out. Joint replacement is actually not a replacement in the sense that we're removing your entire knee. You can think of it as a resurfacing of the ends of your bones. You can do it in your knee or your hip. The ends of the bones are covered with cartilage. When that wears away, then the bone underneath that shiny, smooth surface will start to wear through, and that's how you wind up with bone-to-bone arthritis. And then that causes a host of other problems. Hip replacement is arguably one of the most successful operations in the history of medicine. And it's one of the more rewarding operations that I get to do for people, because hip arthritis is torture. When you think about people that have lived that way for a long time, when you can take that pain away, it makes a big difference for them.
People who need ankle replacement typically have really bad arthritis due to primary arthritis that they just were born with and they developed over time, or it could be due to trauma. Those would be the most likely causes. They would have pain in their ankle, pain with activity, pain with sleep, pain with doing all the things that they normally do for daily living. Recovery for a total ankle is actually faster than for an ankle fusion. When we do an ankle replacement, it takes about 1.5 hours to 2 hours of surgery. Either go home the same day or go home the next day.
We start treating pain even before we start administering pain, so that by the time the pain reaches your brain, we already have started to treat it, so that it make people be able to go through these operations with much less of a burden on them from a pain standpoint. They're home much faster, and it's overall an easier process. I feel like I'm very conservative. We need to know that we've made an informed decision together, that we've tried everything that we can try, and not everybody who has knee pain needs a knee replacement. There are a lot of things that can be very, very helpful that are short of major operations, but you'll never know about them unless you talk to somebody about it.